hospital, and 60%, we've showed it year after year, of the patients had subnormal vitamin C levels. 1 in 5 patients had blood levels compatible with scurvy. Is that really scurvy, or is that something else, and what are the implications? No one knew it because no one had looked. And when I pointed it out to other people, it was just so far out of their radar screen that they just would sort of register it and forget it, as is typical of new ideas.
Now, Abram Hoffer had as a patient Bill W., the co-founder of Alcoholics Anonymous. That's the Bill W., as in, hi, my name's Bill, and I'm an alcoholic, Bill W. He was a patient of Dr. Hoffer's. Well, Bill W. started taking niacin because of depression, severe depression, that often is, unfortunately, part and parcel of getting off of alcohol, especially long-term use. So Bill W. took Abram's advice, which is wise, and he took 3,000 milligrams of niacin a day, and his depression was gone in a week. So Bill talked to friends of his and said, hey, you got to try this. And they took vitamin B3, niacin, and about a third of them had the same results. They were better in a week. And another third were better in about a month. And another third didn't notice much difference. But to Bill W., 2 out of 3 people with alcoholic depression being cured with niacin in 1 week to 4 weeks was pretty good. So Bill W., on his own letterhead, at his own expense, and independent of AA, wrote 3 papers on the importance of niacin in treating alcoholism and alcoholic depression.
Well, Abram Hoffer was a very precise man. Everything that came out of his mouth emanated from a very biochemical worldview. It doesn't mean that he wasn't personable and lovely and nice and kind, and he had a quick wit about him. He was really just quite funny and humorous, but he really saw the world from a biochemical perspective, and he really felt that with good nutrition, particularly optimal doses of different micronutrients, he could really modulate a person's biochemistry in such a way that they would have better mental and physical health. When I give somebody treatment, it's really individualized to what it is that they want help with. But I use things like niacin, which is vitamin B3. I use essential fatty acids. I use magnesium. I use basically all the B vitamins, B12 in particular. I use vitamin C. I use, you name it. Basically, there's about 40 essential micronutrients that we need every day. And I try to individualize as best as I can what